Got to work and I was in charge of the ICU that day, and it was a busy morning. We had a full unit, we had a really sick patient on a ventilator, and right then I knew there was only 3 of us on that day, which is our base staff, but I knew we'd probably need some extra help just to, you know, continue on with caring for our patients plus the really sick one. So we asked one of our other nurses, who's in a different position now, to come and help, just so we had extra support. And we started hearing things about, oh yeah, there's lots of smoke outside, have you looked outside? And everyone's kind of, you know, the hype started happening. Then we looked outside again, and the smoke was incredible. I've never seen anything like it. It was just black. Then I started getting a little concerned, thinking, okay, worst case scenario, what are we going to have to do here? If we have to leave, we're going to have to leave in a hurry, so let's try and be a bit proactive, especially with our really sick patient on the ventilator. So then I started kind of getting the ball rolling with getting prepared, right? So we're preparing medications, getting patients off hospital beds onto stretchers, just in the case that we would have to evacuate. So then we were notified the fire is really close. You know, we're going to have to start moving in a hurry. So proactively, I talked to Dr. Kinda, who was the intensivist on that day, the doctor looking after all the ICU patients, and said, you know, I'm concerned about this lady that we had in the ICU who was on the ventilator, and if we had to leave in a hurry, I want to try and get her out of here as soon as we can, or even before, just in case. So then I knew the traffic was backed up. EMS obviously was very busy. Me and a couple of team members or co-workers decided, you know what, like maybe we can try and get a helicopter here. And I know I work in the emergency room as well, so I know we have Hero 1, which is the helicopter by Phoenix that works with EMS to bring patients to us from rural facilities. So I knew that might be an option. So myself and Katie both got on the phone with Phoenix and started arranging things. I also talked to Central Air Ambulance and got them to be at the airports that we could hopefully get this patient from the ICU to the airport in a safe and timely manner to get her evacuated to Edmonton. Then the helicopter took off and was actually able to land right in the parking lot. So we were able to wheel the patient out, get her into the helicopter with all the equipment, and Tio, one of our RTs, and Katie, one of our RNs in the ICU, I asked them if they could fly with her because the Hero 1 doesn't have medical personnel on it, it's just the pilots. So they agreed, so we got her loaded up into the helicopter. And I remember looking back, and it was, we had masks on because there was ash and debris falling, and it was really hot outside, and we were all coughing, and I remember looking up behind me as we're getting her into the helicopter, and there were firefighters on the roof of the hospital actually hosing it down. So then I realized, okay, this is serious, like we need to get moving because the fire is really close. So they were able to take off and get her safely to the airport, and after that I ran back up to the main floor of the hospital, and in the meantime the other 2 nurses, Shay and Diego, had gotten the rest of the ICU patients out to the front entrance of the emergency room where the city EMS paramedics came and picked us up. So we loaded up the ICU patients along with ourselves in the 2 ambulances, and then basically headed north to safety. Once we left in the ambulance, I kind of looked behind me and seen the flames right across the street, and I realized like how lucky we were to be getting out of there. And you know, in the meantime too, everyone's thinking about their own families and their own situation, their own homes. You know, my husband had called me in the middle of all this at work and said, yeah, like the city's being evacuated. And you know, you're busy doing your work, so I had never heard any of this, right? So he goes, when are you coming home? And it was at that moment I realized, like, I can't go home, right? Like, I'm responsible for all these people, we have a job to do. And, you know, everyone had their moment of kind of breakdown where, you know, you need to take a couple minutes and compose yourself, because it was, you know, it was pretty emotional, and it was scary being away from your family and everything. But it was quite an experience, and especially being in the back of the ambulance, going lights and sirens past all of the traffic, trying to head north, thinking, like, potentially my family and other families are stuck in traffic, and I didn't, you know, you don't know what the outcome of that is going to be because you knew how close the fire was, so that was hard to deal with. But once we got to, ended up at Firebag at the aerodrome there, and we set up an evacuation center. Basically, everyone's family, you know, people had time to get in contact with their families, and everyone's family ended up being safe. But it took us 30 hours to evacuate with the help of Provincial Air Ambulance and STARS and WestJet coming to the aerodrome to evacuate these patients to Edmonton. After the patients from the hospital were evacuated to Edmonton, we then realized we were kind of the only place that was set up to provide like emergency healthcare to the 30,000 people that had been evacuated north. So with all the equipment that different units brought from the hospital, we were able to actually set up a field hospital and provide care to the rest of the community that was now north. We all had our own moments, but at the end of the day, people put this hospital, made this hospital a priority. Whether you're from Fort McMurray, born and raised, this is your home. There's a lot of people from all over the country and all over the world, me being one of those people who has now come to Fort McMurray and made this home, right? So I think that being able to keep people in their home longer, especially in the time of need during like illness, sickness, where you have your home supports, you have your family, you have your friends, that only can help you out, and it can be a more positive impact, right? And I think too, we're able to provide the care that, even though we're a rural facility, we can provide the care that urban centers can provide as well. So we're able to keep patients longer in the home community instead of having to transfer to, say, Edmonton or to a larger center. People don't expect to get sick, and people don't expect to end up in the ER and the ICU. It can be one of the most difficult times in their lives, but if we can support them through this and provide them the best patient care, then we're doing our jobs, and we're doing the job that the community deserves from us. We are here, we are strong, and I think we should keep moving forward to make our community a better place to be. Donate today.